So in part 2 we are going to do more MCQs. हम part 1 को continue कर रहे हैं part 2 के साथ. 41 number question. So you can see a client with schizophrenia come to the outpatient mental health clinic 5 days after being discharged from the hospital. The client was given 1 week supply of clozapine, okay, and the client tell the nurse that she has too much saliva and frequently needs to spit. उसको बार बार spit करना हो को feel हो रहा है. And the nurse interpret the client's statement as indicating which of the following: option number 1, option number 2, option number 3 or option number 4. So guys, for question number 41 the answer will be 3, unexpected adverse effect of clozapine. Let me give you the rationale. So salivalia means the saliva, excessive saliva, excessive salivation is commonly associated with clozapine therapy. तो ये एक important point है. And the client can use a washed cloth to wipe the saliva instead of spitting. तो ये एक मैनेजमेंट आप पेशेंट को दे सकते हैं. नेक्स्ट क्वेश्चन नंबर 42, अ क्लाइंट विद एन एक्सेस 1 diagnosis of schizophrenia undifferentiated type is acutely psychotic and exhibit religious delusion and hallucinations, loose association and concentrated thinking. When the nurse offering the client her medication, the client state, I don't need that, God will heal me. The nurse should respond to the client by saying what? God help those who help themselves. ये थोड़ा सा telepathic communication में नहीं आता है. God wants you to take your medication. God is important in your life, but the medication will help you too. So guys, the option number 3 will be the correct answer. That is the correct way to talk to the patient, which is included in your therapeutic communication. The nurse hand the medication cup to the client who is psychotic and exhibiting concentrated thinking and tell the client to take his medicines. The client take the cup, hold it in hand and stares at it. Which of the following should the nurse to do next? क्या करेगी इसमें से next वो? So you have few minutes, you can solve the question. Question number 43. Guys, the correct answer will be option number 1. Tell the client to put the medicine in the mouth and swallow it with some water. तो यही हम पेशेंट को बोलते हैं. Okay, so the nurse instruct the client. Okay, 43. The nurse instruct the client clearly and directly to put the medication in the mouth and then to swallow it with some water. These are the instructions, clear instructions. Question number 44. Which action by the nurse is likely to increase anxiety and suspiciousness of a client who is delusional? Okay, so which action? Informing the client of schedule changes, whispering with others where the client can observe, telling the client gently that the nurse does not share the client's view, inviting the client to join in leisure activities. तो इनमें से आपको क्या लगता है? What will be the correct answer of question number 44? Guys, the correct answer will be option number 2. Whispering with others where the client can observe. तो ये जो action है nurse is likely to increase the anxiety and suspiciousness in the client जिसको delusion हो रही है, तो ये activity कर सकती है. Question number 45. A client with undifferentiated schizophrenia tells the nurse, okay, that he does not go out much because he does not have anywhere to go. He does not know anymore, anyone in the apartment where he is staying. Which of the following action is most beneficial for the client at this time? So the answer will be, you can give me the answer. Question number 40. Question number 45. The answer will be option number 4. Arranging for the client to attend day treatment at the clinic. The rationale is because the client can live in an apartment setting for the development of independent functioning and the skill to gain as much independence as he is capable of need to be fostered and including the getting out and developing new friendship. Okay, so arrange करना client को कि भाई वो attend करे day treatment in the clinic, it will be the perfect answer. Next we have guys question number 46. So in question number 46 you can see the plan of care for the outpatient client with a chronic undifferentiated schizophrenia includes risperidone therapy. The nurse prepared to administer this drug based on understanding of the which of the following. So we have 4 options, so you have to give me the correct answer. So question number 46, the correct answer will be option number 2. A granulocytosis is less of the risk with risperidone therapy than the clozapam. तो सबको मालूम है कि clozapam के साथ अग्रेनुलोसाइटोसिस होता है. इस ऑप्शन के साथ ये कम देखने को आपको मिलता है. So 46, the rationale will be with CUS. Okay, the negative symptoms are more prominent. Alright, so option number 2, the clozil. So basically CUS यानी कि जो आपका chronic undifferentiated schizophrenia है CUS, negative symptoms are more prominent. Therefore, risperidone is given to help control the negative symptoms. Negative symptoms do not respond to traditional antipsychotics such as Haldol, thyroxine. So, all granulocytosis is commonly associated with clozapine. Because it is a newer drug, risperidone usually is more expensive than the traditional antipsychotics. Next we have question number 47. The client is diagnosed with undifferentiated schizophrenia, is being discharged on the aripiprazole 5 mg each night, which developing teaching care plan about the most common adverse effect. Which of the following should the nurse include? Select all that apply. तो गाइज इसमें से आपने मुझे सारे के सारे आंसर बताना है कि when developing the teaching care plan about the most common adverse effects. Okay, so which of the following should the nurse include? क्या लगता है आपको? Discharge कर रहे हो आप इस पेशेंट को with the aripiprazole. What will be the adverse effects? So guys, for 47, the option number 1, 2 and 3. Headache that will subside in few weeks. Transient mild anxiety and insomnia will be the most common adverse effects. Okay, next question number 48. A newly admitted client, with the acute exhibition of psychotic symptom of same CUS is having trouble deciding whether to live in a group home or a supervised apartment. When caring for this client, which of the following activities is most appropriate? Okay, for the nurse to ask the client to do initially. क्या लगता है आपको इनमें से कौन सा ऑप्शन सही रहेगा? Guys, the answer will be choose between apple and orange juice for breakfast because it will be the most appropriate activity. Okay, जो कि nurse to ask the client to do initially. शुरुआत में आप उसका consent ले रहे, एक तरीके से आप पूछताछ कर रहे हैं. So it will be like good. The client is in acute psychotic phase and cannot process complex decisions. So that is the reason. 49. So question number 49. Outpatient client who has been receiving haloperidol for 2 days developing muscular rigidity, altered consciousness, a temperature of 103 Fahrenheit and trouble breathing on day 3. The nurse interpret these findings as indication of what? Neuroleptic malignant syndrome या tardive dyskinesia. So guys, everybody know that neuroleptic malignant syndrome. ये जितने भी symptoms आप देख रहे हो haloperidol की वजह से neuroleptic malignant syndrome के अंदर आते हैं. The client is exhibiting hallmark sign and symptom of life-threatening neuroleptic malignant syndrome induced by the haloperidol. Tardive dyskinesia usually occur later in the treatment, typically mouth to years later. Okay, months to year later. Extrapyramidal adverse effect जैसे कि dystonia, akinesia and drug-induced Parkinsonism, although common but are not life-threatening. So that's a very important question. Question number 50. A client with chronic undifferentiated schizophrenia report doing very little all day except sleeping and eating. Okay, the nurse should what? These are the options. Guys, answer number 3. Help the client to set up daily activity schedule to include setting a wake-up alarm. तो इस प्रकार से आप इनिशिएटिव्स लोगे एंड इस प्रकार से जो है वो नर्स को इंक्लूड करने चाहिए. शी शुड. ओके, because the client is suffering from CUS, report doing very little all day except sleeping और eating के अलावा कुछ भी नहीं कर रहा है. तो भाई क्या करना चाहिए? हेल्प करो क्लाइंट को डेली एक्टिविटी शेड्यूल कर सके और सेटिंग और वेकअप अलार्म मेरा सेट कीजिए. नेक्स्ट क्वेश्चन नंबर 51. The nurse note that the client sitting in a chair has not gotten up. 1 घंटे से वो वहीं बैठा हुआ है. The client does not respond to verbal directions and her arm has been extended over the armrest for 30 minutes. Which of the following the nurse should do? क्या करना चाहिए नर्स को नेक्स्ट? What will be the answer, guys? Question number 51. Option number B. Give PR and prescribe dose of haloperidol and lorazepam. Muscle relaxant और थोड़ा सा सुला दीजिए, थोड़ा सा patient will feel much better. So the rationale is the client is exhibiting catatonic behavior, acutely serious result of severe anxiety and psychosis. In this situation, the nurse need to administer PR and order. What is PR and order? These are the when required. Okay, so prescribed dose of haloperidol and lorazepam. This will given together safely, and we have to assess the client. Next question number 52. We have what is the most appropriate long-term goal for an outpatient client with chronic undifferentiated schizophrenia who has been withdrawn from friends and family for 3 weeks. तो क्या लगता है आपको, what will be the correct answer? So guys, option number 2, attending day therapy 3 times a week will be like, you know, good option, most appropriate long term goal for outpatient client जो इसे सफर कर रहा है भाई, उसको क्या बोलना है कि आपको जो है वो अटेंड करना है, ओके, अटेंड करने हैं डे थेरेपी 3 दिन एटलीस्ट एक हफ्ते के अंदर, ताकि मैनेजमेंट हो सके और पेशेंट कांटेक्ट में रहे और इम्प्रूव करे. फॉर द क्लाइंट विद कैटाटोनिक बिहेवियर्स, ओके, which of the following should the nurse use to determine that the medication administered as needed has been most effective in the long term? Guys, question number 53, the correct answer will be option number 4. Okay, so option number 4 will be the correct answer. The client initiates simple activities without direction. इसका मतलब है कि कहीं ना कहीं most effective long term में you know medication जो आप दे रहे हो as needed has been most effective in the long term, अगर वो इंसान जो है वो अपना काम खुद कर पा रहा है तो. ओके, सो द क्लाइंट इनिशिएट सिंपल एक्टिविटीज विदाउट एनी डायरेक्शन, वो करना स्टार्ट कर चुका है, तो इसका मतलब है कि लॉन्ग टर्म इफेक्ट्स जो है वो सही हैं. ओके, ऑल राइट, नेक्स्ट क्वेश्चन 54, द मदर ऑफ द क्लाइंट विद क्रॉनिक अनडिफरेंशिएटेड स्किज़ोफ्रेनिया called the visiting nurse in the outpatient clinic to report that her daughter has not answered the phone 10 days. She was doing so well for months. I don't know what's wrong. I'm worried. Would be the following response then why the nurse is the most appropriate? तो आपको क्या लगता है? In these 4 options, guys, the option number 2 will be the correct. She may have stopped taking her medications, so I will check on her. तो हो सकता है उसने अपनी दवाई खानी बंद कर दी, जिसकी वजह से उसको दोबारा से रिलैप्स हुआ है, क्योंकि मैंने पहले भी बताया कि मेडिकेशन रिलैप्स बहुत कॉमन है, तो ये हो सकता है. नेक्स्ट question number 55, during a home visit the nurse discovered that the client is less verbal and less active, less responsive to direction, severely anxious, more stuporous. The nurse interpret these findings to indicate the client needs to which of the following? Guys, क्या लगता है आपको? होम विजिट किया आपने और डिस्कवर किया ये सब चीजें, तो आप क्या कर सकते हैं इन द क्वेश्चन नंबर 55? So guys, the answer will be option number 4, immediate medical evaluation. It's very very important. Next question number 56, you have in front of you question number 56. आपको बताना है, a client admitted with a diagnosis of schizophrenic, schizoaffective disorder, manic phase, who is currently taking fluoxetine, valproic acid, or olanzapine as prescribed, has had increase in manic symptoms in the past weeks. The psychiatrist prescribed valproic acid, blood level to drawn at once. Okay, the nurse understand the rationale for this. क्या है भाई rationale? What is the rationale behind it? So guys, in this the option number 3 will be the correct answer. The decrease in the level of valproic acid could explain the increase in the manic symptom. हो सकता है valproic acid का लेवल अगर कम हो, ओके, तो इसकी वजह से मैनिक सिम्टम पेशेंट को देखने को मिल रहे हैं, हो सकता है, तो इसीलिए आप इन्हें यूज करोगे. लेट मी गिव द रैशनल. valproic acid is commonly used to treat manic symptoms, therefore decrease in the valproic acid level could explain the increase in the manic symptom. Effectiveness of the drug, however the stat nature of the specimen to be drawn indicates an immediate problem. Okay, so next question number 57 you have in front of you. A 22-year-old is being admitted with a diagnosis of brief psychotic disorder. 2 weeks ago his girlfriend broke off the engagement and cancelled the wedding. Give the diagnostic and statistical manual of mental disorder, 4th edition. Text revised criteria for this disorder. The nurse should expect to find which data during the interview with the client. क्या लगता है आपको? एक पेशेंट 22 years old है एंड ये उसको डायग्नोस किया गया है साइकोटिक डिसऑर्डर. 2 weeks ago उसकी गर्लफ्रेंड ऐसा सब कुछ कर लिया उसके साथ. व्हाट डू यू थिंक? सो गाइस, इसका मतलब है कि कहीं ना कहीं पेशेंट क्या कर रहा है, कुछ अब्यूज कर रहा है साथ में, ओके, ऑफ देयर एंगेजमेंट एंड कैंसल्ड द वेडिंग. गिव हिम, जो कि डायग्नोस्टिक जो हमारा डीएसएम है मेंटल डिसऑर्डर का, उसका 4th एडिशन में रिवाइज किया गया क्राइटेरिया इस डिसऑर्डर के अंदर. शुड एक्सपेक्ट द फाइंड विच ऑफ द डाटा ड्यूरिंग द इंटरव्यू. गाइस, अल्कोहल वगैरह मैंने बता रखा है, डीएसएम 4 एडिशन में हमें ये देखने को मिलता है, अल्कोहल एंड ऑल. सो गाइस, द ऑप्शन नंबर द क्वेश्चन 57, द आंसर विल बी यू नो रेगुलर यूज ऑफ अल्कोहल एंड marijuana. ये कहीं ना कहीं आपको नहीं देखने को मिलेगा. देयर विल बी लाइक hallucinations, delusions and everything. So यहाँ पे जो इसका डायरेक्ट आंसर जाएगा that will be the evidence of delusions and hallucinations. तो आपको यही देखने को मिलेगा. Let me give you the rationale. According to the criteria of DSM-4, okay, 4th edition, next text revised, a diagnosis of brief psychotic disorder is made when the client exhibit delusions and hallucinations. तो हो सकता है पेशेंट को तभी आप डायग्नोस करते हो साइकोटिक में अगर वो इंसान डिल्यूजन और हैलुसिनेशंस कंफर्म बता रहा है आपको, तभी आप इन्हें डायग्नोसिस में लेते हैं, और जो कि ऑलरेडी मेंशन भी किया हो गया है DSM 4th एडिशन के अंदर। ओके, हाँ पेशेंट अल्कोहल भी कंज्यूम करता है, मार्जुना भी करता है, उससे भी आ सकता है, साइकोसिस में हो सकता है, बट 4th एडिशन में क्या बोला गया कि कब डायग्नोसिस किया जाएगा, जब आपके पास एविडेंस है डिल्यूजन का और हेलुसिनेशंस का। नेक्स्ट क्वेश्चन नंबर 58, a successful real estate agent brought to the clinic after being arrested for harassing and stalking his ex-wife denies any other symptom or problems except anger about being arrested. The ex-wife report to the police he is fine except for this irrational belief that we will remarry. Okay, when collaborating with the healthcare provider about a plan of care, which of the following will be the most effective for the client at this time? क्या लगता है इनमें से मोस्ट इफेक्टिव क्या रहेगा क्लाइंट को इस वक्त? So guys, question number 58 in front of you, the answer will be referral to an outpatient therapist. Rationale is follow-up counseling is appropriate because the client anger and inappropriate behavior. So the goal is to help the client deal with the end of his marriage. A joint session might have been useful before the divorce and arrest, but not after. उसके बाद उसका कोई लॉजिक नहीं रह गया. So the client is exhibiting no sign and symptom of schizophrenia, psychosis. So olanzapine is not indicated. Okay. Next, question number 59. So guys, the question number 59, the question is in front of you. I will share the answer. The question is in front of you. The answer will be option number 4. Custodial care in long-term hospitals. The rationale is during necessary period of hospitalization, active treatment rather than custodial care is needed. Okay, so that will be the rationale behind it. Question number 60, the nurse is planning care for a group of clients who are chronically mentally ill. Which of the following strategy is likely to be the least beneficial for the client population? So guys, the question is in front of you. The answer will be option number 3, helping client in the insight-oriented therapy. The rationale behind it, insight-oriented therapy is less beneficial for this client population. The nurse's role in a psychological rehabilitation program involved teaching the client to live independently by using interpersonal skills and community resources. Question number 61, that is in front of you. I will tell you the answer. Question number 61, the answer will be option number 3, asked to speak to the client directly on the phone. Question number 62, a nurse is teaching the family of client with chronic mental illness about cause of relapse and rehospitalization. What should the nurse include as a primary cause? So guys, the answer will be question number 62. The answer will be 2, non-compliance with medications. Okay, the rationale is non-compliance with medication is documented at the primary cause of relapse. So it's very important. मैंने बहुत बार mention कर दिया कि relapse medication ना खाना, it's like very common. Question number 63 in front of you. Question number 63, the answer will be option number 3. Question number 63 in front of you. A client is diagnosed with schizophrenia and alcohol. So here question number 3, guys, the answer will be option number 1. The decision to use alcohol is a wish to feel accepted by others. So this behavior will be the nurse recognize which of the following underlying dynamic of the client alcohol use. अगर कुछ इस प्रकार की बात वो बोल रहा है तो question number 64 in front of you. Question number 64 in front of you. You can pause the video and think about it. The answer will be option number 4. Your pain will be controlled by tapering doses of oxycodone with other pain management strategies and medications. All right. Next question number 65. The answer will be option number 1. Monitor for paper bag and rags that may have been used for breathing inhalants. Option 4. Death from inhalant occur from the asphyxiation, suffocation and aspiration of vomit. Option 5. Inhalant usually cause depression of the central nervous system. And option number 6. The basic group of inhalant are hydrocarbon solvents such as glue, aerosol and your propellants from the spray can and anesthetic gases. Alright guys, so make sure these answers are the correct answers. 65, 1, 4, 5 and 6. Next, question number 66. In front of you, the correct answer is option number 1. Respiration rate 9 breaths per minute. The rationale behind it will be 66. Respiratory rate less than 12 beats per minute is the cause of concern because of central nervous system depression. तो यहाँ पर इसीलिए रेस्पिरेटरी रेट इतना कम जो है वो आपका फोकस जाएगा. क्वेश्चन नंबर 67, the answer will be question number 67, the answer will be 1, 2 and 3. 1, 2 and 3 will be the correct answers. Next question number 68. Question number 68, the answer will be 4, increased respiration, and 5, consciousness. Question number 69, the answer will be option number 1, vomiting and diarrhea. Vomiting and diarrhea. Question number 70, the answer will be option number 4, respiratory depression. Question number 71, the answer will be 4, the client may work and live normally. The question number 72, the answer will be 1, try attending a meeting at the different locations, you may feel more comfortable there. तो ये बात बोलना, it's like beneficial in this question. Next, question number 73, the answer will be 2, the number of drug-free days he has. Next, question number 74, in front of you. Question number 74, the answer will be 4, option number 4, hypoactivity. Next, question number 75, the answer will be option number 4, respiratory failure. Option number 76, question number 76, the answer will be option 4, her condition is serious, you should very worried about her. Question number 77, question number 77, the answer will be option number 1, tolerance. 77, option number 1 will be the correct answer, tolerance. Next, question number 70, so here we have 77, 78, question number 78, guys, question number 78, the correct answer will be option number 4, you are in hospital because of drug problem, I am one of the nurses who will help you. Question number 79, the correct answer will be option number 2, I know you took an overdose of barbiturates, are you thinking of suicide now? So you have to ask this thing. Question number 80, the answer will be, question number 80, the answer will be option number 1, the client will discuss her feeling related to her losses. Question number 81, the answer will be, question number 81, the answer will be option number 4, discussing the behavior at the daily community meeting. Question number 82, question number 82, the answer will be option number 4, directing the conversation to realistic concerns. Question number 82, the answer will be option number 4. Question number 83, question number 83, the answer will be option number 3, that drug causes more damage to your body than regular cigarettes. Question number 84, question number 84, the answer will be option number 1, using ecstasy is similar to using speed. Ecstasy is used at all night parties. Option number 4, it can cause death. Option number 5, it reduces self-consciousness. Question number 85, you have to maintain the sequence. You can see that the question number 84 we are done. Question number 85, so guys, the answer will be 3, 4 and then 2 and then 1. Okay, so just remember, I'm repeating the answer, 3, then 4, then 2 and then 1. 3, 4, 2, 1 is the correct answer. Question number 86 in front of you. Question number 86, the answer will be option number 4, encourage safe verbalization for her emotions, especially anger. Next, question number 87, guys. Question number 87, the answer will be, you can see that question number 87, question number 87 in front of you, the nurse is planning care, so identify the needing the most assistance in accepting ill. So question number 87, the answer will be option number 4. The answer will be option number 4. Okay, answer number 4. Then after question number 88, the answer will be option number 4, shows sign of self-control. And in the last 89, the answer will be 1. The emotional response may be similar to those of other crime victims. Alright guys, so we are done. Okay, so we are done with the questions. I hope this video is like very beneficial to you. Please अपना साइकेट्रिक पढ़ने के बाद आप इन क्वेश्चंस को जरूर कीजिए. अगर आपके क्वेश्चन सही जा रहे हैं इसका मतलब है आपकी जो तैयारी है वो बहुत ही ज्यादा अच्छी है। ध्यान में रखना है कि फार्मा और साइकेट्री को दोनों को साइमल्टेनियसली पढ़ना है, बिकॉज साइकेट्री काफी इंपॉर्टेंटली फार्मा को इंक्लूड करती है और उसी फार्मा के जो ड्रग्स हैं उनके साइड इफेक्ट्स, उनका रिलैप्स, बिकॉज एवरीबडी नोज दैट साइकेट्री का ट्रीटमेंट बहुत ही ज्यादा मुश्किल है। एक पेशेंट जो मेंटली इल है उसका मैनेजमेंट करना मुश्किल है। दो बातों का ध्यान रखना पड़ता है। द नंबर वन इज अ थेरेपेटिक कम्युनिकेशन, वो ध्यान में रखना है कि आप जब जवाब दें तो सोच समझ कर जवाब दें। और ऑप्शन नंबर टू इज द ड्रग्स, दैट्स व्हाई मोस्ट ऑफ द क्वेश्चंस आर oriented towards whether they are just related to your therapeutic communication or they are related to your drugs. So be aware and please आप इन क्वेश्चंस को बार बार प्रैक्टिस कीजिए। अगर आपने कर रखे हैं तो बहुत अच्छी बात है, नहीं तो आप इन्हें दोबारा प्रैक्टिस कीजिए ताकि आपकी जो कमांड है साइकेट्री में बहुत अच्छी हो जाए और कोई भी क्वेश्चन आपका गलत ना हो। थैंक यू सो मच। और अगर आपको इससे रिलेटेड और भी वीडियोस देखने हैं रिलेटेड टू योर साइकेट्रिक टेस्ट, stay tuned because tomorrow again we are going to post one test online.